I think now we are live. Yes. Okay. I think we can start. Perfect. Okay. Okay. Salam alaikum. Good afternoon, good evening, and good morning, depending on from where are you watching us tonight. My name is Yasmina Shamimi. I am resilience coach. I work with women dealing with health issues. I help them to overcome fear, manage the stress, find inner strength, and reach the inner peace. I've been through the path of cancer myself, and I know how is it to go through this path. I understand the fear that is coming with it and how overwhelming everything can be. That's why I dedicated myself to help women dealing with these health issues, and I founded Fear No More, which is a program dedicated for these women to give them support and create a safe space for them. So welcome everyone, and tonight we have the pleasure to have with us Dr. Abhinav, who is a radiation oncologist for the last 24 years. He has been working in India, KSA, and UAE. His interests are most in the breast, head and neck cancer, gastrointestinal, and lung cancer. Actually, he is associated with the Saudi German Hospital, American Hospital, and the Prime Medical Hospital in Dubai, and the Gulf International Cancer Center in Abu Dhabi. He has a special interest in spirituality and yoga. He brings this into the community, into people around him to help them include all this aspect into the life. So welcome, Dr. Abhinav.
Thank you so much. Thanks for having me here. And
Thank
good
you.
evening, everybody, and greetings as per the time zones. So we are global now, so we do not know sun is shining or moon is shining at your on the part of the world where you are. So thank you, Yasmina, for having me here,
Thank
and
you,
I'm
Doctor.
delighted to be a part of this show.
Thank you, Doctor. So, over this session, we will explore the following topics. We will understand briefly what is the cancer, what are the type of cancer, the cause and the factors, the treatment, surgery, chemo, radiation, and all kind of treatment. What are the coping mechanism? Okay, and the strategies for emotional impact, and what are the post-treatment care, what are the follow-up that we have to follow. We want just to outline here that we are not focusing on the medical aspect. We are mostly focusing on the emotional aspect and psychological aspect, as everything is covered by the doctors in the hospitals on the medical side, and only the emotional that we found that we need more support, and we bring it to the people. Okay, so let's embark together. Welcome everyone, and let's embark together in this journey. Together we will empower ourselves to go through this journey, or help some members of the family to go through this journey. Just remember that you are not alone. So welcome, Dr. Abhinav, once more. And before we start, could you please introduce who is behind the Dr. Abhinav?
So that's a very good question and a difficult one. But if we go as per the normal understanding, so I am originally from India. I am from Delhi, and last 30 years I am in medical profession, and in oncology I am since last 24, 25 years. So I am ancient a bit, and I have worked in India in different good institutes there, and then moved in 2006 to Saudi Arabia, and in 2014 I moved to UAE and had the pleasure of honor of working in good centers across the UAE, in Alain, in Abu Dhabi, and in Dubai. And I have seen the growth of oncology in India, in Saudi Arabia, and in UAE, how nicely the oncology setups have grown. So, and apart from this, I am a yoga enthusiast and a spiritual seeker. And I believe that spirituality and secular life should be integrated with each other. It should not be, there should not be corridors or times that this is the time allotted for spirituality and this is for our secular life. This should go on every moment of our life. Spirituality should be there along with our normal day-to-day life every moment.
I agree with you, doctor. Thank you very much. Thanks a lot. So, shall we start, doctor?
Yeah, sure. Thank you.
Okay, so the first question that everyone is asking, what is cancer? If you have to explain it with the normal people language.
So, in a very simple language, we can say that cancer is like a particular group of cells which have broken away from the physiology or the control of our body natural mechanisms, and have started multiplying on their own due to some defect in the genes or DNA. And they have started multiplying and increasing in their size and number. And then they spread to different portions of the body. And they start, like parasite, they start eating on the different organs and different mechanisms, and this
Oh,
causes the debility in the body. So this is basically a very simple definition of cancer:
okay,
loss
okay.
of control on the cells, particular
Yeah,
type.
amazing, amazing. So, doctor, what make these cells to transform or to start to eat from different mechanism, different organ? What are the primary cause of that?
So the causes are so many, and finally the cause would be the action on the DNA where the multiplication happens, but causes are many. And if we see, if I go a bit, in when we started as an oncologist 25 years back as students, so the cancer incidence was not that high as we see today. Like, for
Exactly.
example, we see now it is very common. The statistics in US is that 40% of a person people will touch upon cancer diagnosis somewhere at some point in their life.
In the
So this
life.
has become so common. And incidence in Dubai is very high for breast cancer, for example. 60% or more of the patients which we deal in oncology clinics are related to breast cancer, and
60%.
60% or more. So, what has caused this enormous rise in incidence and this epidemic of cancer? Just if we forget rest of the causes which were always there, there can be so many causes inflicting this trauma to the cells or the DNA causing cancer. But what is the common logic is that the change in lifestyles in
Mm.
last 3 decades, which has caused sudden rise in cancer. The life has become very fast with globalization, with increasing socioeconomic status of the people, with the business minded and people, they don't have time. It has become a very nice phrase. They feel, we feel grandeur when we say that I don't have time. So, but
Yeah,
this is a very problematic statement, because we are indirectly saying that we don't have time to take care of ourselves. We have time to fill our banks or do the jobs which are occupying
exactly,
so much that we forget our body and mind. And
exactly,
in
doctor.
this case, somewhere we have started consuming products which are also fast forward. So, fast food, junk food,
Mm.
preservatives, chemicals, all these have increased in our consumptions. Our
Yeah,
natural activities of body have decreased. We go to gyms, but maybe in the gym also, when we are doing activities, our mind is stressed for the next
Mm.
day or the time which has passed on in the same day. So
Yeah.
that we are not connected to nature basically. We are
So we are,
departed. We have created a gap between us and the nature. So that may
so
be the main cause.
yeah, so doctor, you said the lifestyle, the lifestyle, the way how we are living. Everyone is living like that. Everyone is running, and you mentioned the stress. I remember that 20 years ago, I always heard that stress is become the disease of this century. Everyone is stressed, everyone is under stress, and as you mentioned that we are eating junk food, the food is ready, it makes our life easy, you know, to just grab something to eat, to drive and eat, and to run and to eat in the office. No one has time to sit and to eat like everyone, right? So what are the other factors?
So many factors like consumption of alcohol. If you see all across the world, 3 decades back or 4 decades back, it was still a taboo, especially in the East, like in India or other parts. But now it has become a symbol of your socio-economic growth. So
Exactly.
alcohol definitely is directly linked with at least 7 type of cancers. Then tobacco consumption has not reduced. Smoking is rampant. I see people smoking in the area, in the hospital areas also. So it is a
Yeah,
very big irony that hospitals allow smoking, and we are treating patients who have come due to the effects of smoking inside that building. Then recently we see the youth getting, the electric cigarettes, the
vape,
vape.
vape.
So
Yeah.
much has increased, and all of this is dangerous. And we need some, government intervention into it. But definitely these are the causes, apart from the consumption of red meat, which is rampant. uh, Colorectal cancers are high in Middle East. That is a proven cause. Then so many other causes, which as we already pointed out, the
Yeah,
chemical intake, the environment is not as fresh as it should be. Then stress itself, it is a very undermined or underrated effect. The stress and the mind has a huge effect on body.
yeah,
So a
exactly.
person is not normal. A body cannot be healthy no matter how much gym or how much activities you do, if your mind is also not healthy.
Yeah.
So
So the
that
stress,
not yeah.
yeah, you are right, doctor, because the stress is knocking our body and mind out of balance. So we are always, our body is always using a lot of energy inside, the resources inside, to get to this balance. And as we are always staying on stress, under stress, so this affect our cells, DNA, and everything is disrupted inside our body. Okay, and what are, doctor, the different modalities of cancer
Yeah,
treatment?
so if I come to that, just 2 points before that, the good news. The good news is that there is a substantial progress in screening and early detection of cancers with the advent of screening procedures, and
Mhm.
early detection is feasible. We have so many advancements in scans, and then we have significantly added to the lifespans, the extended life spans for the patients, because of advancements in various treatment modalities. The treatments which were 20 years or 30 years back have become obsolete, and we cannot imagine that we used to treat like that. Be it surgical treatments, we have now robotic surgeons, we have now super specialized surgical oncologists, site specific, site subspecialist surgical oncologists, very nice operation theaters, and huge advancements in anesthesia and ICU care. The recoveries are good, the wound healings are good, the plastic surgeries are good. So very nice advancements in surgeries. Then medical oncology has taken so much of surge ahead. where not only chemotherapies, but there are targeted therapies, there are molecular biological therapies, there are immunotherapies which have come into picture. So a lot of armamentarium to hit the same cancer which was there, and we
Okay.
have so much of choices. Radiation oncology, which is my field, has seen a huge advancement in technology, and so much of high precision technology is now available, and it is growing every year. It is changing every year, and we are advancing every 6 months, every 12 months to a higher technology, and we can give more high precision radiotherapies and with less side effects and more of effectiveness. So
Oh,
this is
okay.
added to the outcome of the patient. So at least the patients which most of them are curable. So that is a good news, which I want to convey. So curability has increased, and also if it is a very advanced tumor or metastasized, means spread tumor, still we consider it and treat it as a chronic disease rather than a terminal illness. So
Okay.
a lot of survival is feasible.
Yeah. So if I understand, that's mean now the cancer is like any other disease. It's not the word that I know that in some
Yeah.
culture you can't even pronounce the word cancer. They say always this disease, you know. They don't really mention it's like a taboo or something like that. So is it now treated, or is it something curable, like if you have maybe I want to say flu, or you know, or another like heart disease or something, that's at least you are not scared, and you
Yeah,
can you
when
it's
detected
curable.
early, it can be cured, although may not be, we cannot equate it with flu and other things. But yes, it is, the scenario has changed. And with the way the science is advancing, we hope in next few years it would be like treating any infection. So the science is advancing so much.
Yeah,
So, but
it's
the issue
actually
comes is that biomedical care has advanced a lot, but there is a huge
yes,
gap between the psychosocial support given to the patients. Unfortunately, all across the globe, even the advanced countries or other countries or anywhere, if you see
sorry.
the hospitals, big institutes, universities, everywhere the medical biomedical care has advanced tremendously,
Exactly,
but the psychosocial support has lagged behind. We do not
exactly.
integrate psychosocial support for the patients in the oncological managements.
Yeah.
It may be
So
on the paper sometimes, but I have not seen in my 25 years that it has been seriously implemented.
exactly. So we will come to this point, doctor. Just after one question, we have someone Monday talks. Are there initial symptoms as a signs of disease occurring? Sorry.
So I think if I get the question right, it is that what are the initial symptoms of the disease?
Yeah.
So it depends on the sites. So like for head and neck, like you can have some change in voice, or you can have some difficulty in eating food, or you may feel some lumps in the neck, or any changes in the oral cavity, and in ulcer which is not healing for more than 2 weeks. Then you should be aware in the breast, like if you have lumps, most of the lumps, first of all, the girls or the women should not get stressed. 90% of the lumps which are felt are benign. So and most of these are in the age of 30s and 40s, so these are benign fibroadenomas. But if you feel any lump, it is always better to seek medical advice and to undergo screening procedures as per the recommended age group with your doctors. Annual checkups are good to do, especially after the age of 30. Then vaccinations are there for some cancers like cervix cancer, which are the government in UAE is very good in that they implement it at the school levels, and it is for both boys and for girls. So oral cancers, oropharyngeal cancers, and the cervical cancers are taken care of with that vaccine, very effective vaccine. And then other symptoms can be as per the, like if you have bleeding per rectum, or if you have postmenopausal bleeding. So all these are alarming signs and symptoms. Anything which is different from the normal, it is always better to consult a professional rather than to keep quiet. Yeah,
Yeah.
because early
Uh,
detection is the main aspect.
Yeah, but usually, doctor, I know that all these signs, sometimes we have them and we say, okay, I don't have to worry about, and I don't go to treat them because it will go, it will go. So you said we have to wait like how many times to see if the symptoms are not, I mean, we are treating them with the normal medicines and they are not gone. When should we be a little bit worried and go to see maybe the oncologist, or which doctor we have to go to see directly at that time?
Persistent symptoms, bleeding, lumps, or
Oh,
any ulcerations, or any means difficulty to eating foods, or these type of symptoms which are persisting for more than a few weeks, 2 weeks or so, means always it is better to go to a specialist. Even if you are not going to an oncology center, even our others like gynecologists are well trained to pick out,
yeah,
or these
on the
the general surgeons are well trained. So even general physicians, the GPs, all of us go through a good training even at the primary level to pick up the symptoms. And then as per the age, there are screening methods which can be employed. So
mm,
like checking PSA for older than 50, or doing ultrasound mammogram for older than 40 in females, then doing and uh, colonoscopy for people.
endoscopy.
All this is already in the system and in the guidelines and implemented by our hospitals. Only
Right,
thing
right.
is that people ignore it for months and months, which is very dangerous. Like for example, one of the female patients, she said that she had lump in breast last year, but her husband said no, it must be something normal. So they ignored it for 7 8 months.
Noted.
It
Yeah,
is
yeah.
not acceptable.
Yeah. So I think yes, you are right, doctor. We usually do that. As I mean, everyone is mostly are doing the same. We have another question from Nadia Bendriwush. Is there any signs or symptoms that can alert us, like what you said, maybe the bleeding, the swallowing, and if there is any lymph nodes, etc. Would you like to add something to that?
The thing is, there are so many awareness things running across the country throughout the year. Like in October, we had the Breast Awareness Month. So means everywhere on the media also this our fraternity is not lagging behind in this. The awareness we are giving to the public, and even the government is very active in this. The
Yeah.
awareness goes on the media.
Yeah, doctor, the awareness is it's only for breast cancer or for any type of cancer, any other
Most
type of
commonly,
cancer?
60% in Dubai and Abu Dhabi, more than 60% in UAE are breast cancer patients. Then
Exactly. Oh,
awareness for blood in stool and all is also there. So PSA awareness for prostate, then
yeah,
any symptom like blood in sputum or something. This is already an alarming sign, and so we should approach a medical fraternity anywhere,
yeah,
any hospital. We can go and get basic checkups.
yeah. Bearing in mind that our audience is not only in UAE, we have people in
Yeah,
other
but
countries.
everywhere I think I have worked in different countries. I have been in Bahrain, I have been in Muscat, I have been in UAE, Saudi Arabia, India. I have, I know the system in UK, in US, which are more, good in this to picking up early tumors. So all across the world, this message is very clear that if we have persisting symptoms, which is unusual, always it may not be cancer, but it may be something else also.
Yeah,
So if you go even to a GP, he can guide you to a proper specialty as per the symptom.
yeah. So we don't have to ignore the symptoms. We have to go
And
and to check.
self-awareness is very important to be aware of your own body.
Yeah.
Sometimes we are ignoring our body.
Without over worrying, just we go and we get it checked. And
Exactly.
it's better to check it in advance and to treat anything
And
in, I
I
mean,
believe if it is nothing
early.
there,
Yeah,
probably it will be nothing. So you will not keep something in the back of your mind for months.
exactly, exactly. We have another question from Hind Ismail. Until which age we could do the vaccine?
So vaccine is actually best for the cervix, I think she's asking. So that is best in the age group of 12 to 14, which is best age group, but anytime in the school group. But later on, once the woman gets sexually active or married, then it is not of that effectivity. So it is in the teenage basically, which is, and it is recommended in most of the countries. It may not be mandatory, but it is informed to the parents of the school children, because
Yeah.
it is recent, last decade only. So it is informed to the population at
Yeah,
large.
about the new vaccines, and even if it's not mandatory. Okay, we have Smita Kapoor. I think she's one of your or from your patient. Absolutely convincing, very patient, and absolutely motivating doctor. Best radio oncologist. Thank you what for the help that in her treatment.
Thank
Okay, so you mentioned, doctor, a very important things. What are the factors that influence the prognosis of cancer patient?
Yeah. So first thing is prevention is the best cure. So improving lifestyles. So, but as we feel that what can impact the prognosis once it is there. So early detection. So screening helps in that. Self awareness, self examinations, like for example in breast, should be taught to the girls. Then early detection. So if we can detect early in an early stage, definitely 100%, 90 to 100% curability is there. And
Yeah,
even in advanced cases, as soon as we approach, as soon means whatever, earliest possible, we can approach an oncology facility. That is the best way forward. So all these impact. The stage is the main thing from which we see the type of cancer, the histology of the cancer, the biology of the cancer. All this impacts, like in breast, receptor positivity or negativity. Then
mm,
what is the biology of the tumor? What type of cells actually have? There are so many. In one side there can be so many different type of cancers. Like lung has so many type of different cancers, from
yes, there is a
good
lot.
to bad. The brain has so many, like if we have brain tumors, so there are so many, from benign to so many highly malignant cancers. So
Mm,
prognosis depends on that. Prognosis also depend on the team approach for the cancer. All these modalities which we have spoken together cannot work independently. They have to be together as a team and formulate a protocol for the whole treatment of the patient up till the follow-ups, and
yeah,
then work in a proper way as per what our research and present guidelines show. So this team has to be integrated together. The medical oncology, the surgical oncology, the pathologist, radiologist, the radiation oncologist, all have to integrate together to form the
mm,
best possible treatment from in the first instance. First
yeah.
treatment is treatment which is most effective and most important.
Okay, so I have two questions here. One is still on the medical field, so we'll cover it. Are there clear causes for cancer in our lifestyle that has direct impact? Is
I would
there?
rather suggest, instead of searching causes, let us go back to naturalness in our lifestyle. That will, because there will be multiple, hundred of causes like chemicals and all. We can't keep checking
Mm,
which food has what. So why not we go to natural foods? We go more towards things which are already proven. Go away from tobacco, go away from alcohol, go away from known carcinogenic things, and improve our natural health. Be close to nature. We are a part of nature. More we depart from nature, more illnesses will creep up. It is not only about cancer, it is about any illness, be it of the body or be it of the mind. More we are closer to nature, more we are free from these illnesses.
what do you mean, doctor, to be closer to nature?
Closer to nature is that, like, we all are busy, we know, but at least we should find some time to be near to nature. Like if you have a water body near your house, go and walk near the water body, or go rise up early in the morning if you can, breathe the fresh air, see the sunrise, do
Mm,
some practices. Like I have the tendency to push people towards yoga. So yoga
yeah.
is a very good thing, but largely misunderstood. It has become a technique of bending the body and twisting the body here and there, which is actually not yoga, but it is just a very minute part of yoga. So if
Yeah.
we turn towards proper yoga, our breathing, which is called pranayam, the breathing exercises,
Pranayamas, yeah.
and try to be more loving towards nature, the nature will love us. So more, we can't avoid everything. Like we have to go to work, definitely. But even if we are going to work, if we dedicate that work also to nature or to God or whatever belief we have, and we work as a service towards the nature, as a part, we are a part of this universe, so we are serving that society, that nature, that country. If we inculcate this habit in us, it is not only about earning, so our mind improves.
Yeah, you are right, completely right, doctor. Also, as a coach, I always also advise my clients to breathing, to incorporate breathing. Breathing is a tool, is a magnificent tool that we have within us. That just we focus on the conscious breathing, just to breathe consciously, slowly, and focusing on your breathing. This help us to breathe and to balance our nervous system, which we said it's connected with the stress, and we have a stress and being under stress on daily basis. This knocked out our balance, our body and our mind, and it's out of balance. So this, and you are like I said, the proper, you open the door for the disease. Thank you. We have another question of KL. How to accept and manage to live with the disease? What is your advice, please, doctor and Yasmina?
Yeah. You want to begin, Yasmina? Uh,
You can. Then I finished. Yeah.
Okay, so now what I see in my patients, or we have everyone knows that when anything happens, like a diagnosed cancer patient, so patient has three main type of sufferings which come. These are all, first is the suffering of the body. So the some body organ will be having cancer, so there will be some debility, there will be some pain or some symptoms which will impair the functioning of the body, and there will be some fatigue. So these things will happen. This is at the gross level, the suffering
Yeah.
from the cancer or any disease.
Should be. Yeah.
Second thing which happens is the psychological effect. The patient starts feeling or imagining that, because the patient doesn't know what has happened and what this disease may be. No matter how much advancement we have done, the cancer word still is a big a big trauma for anybody to
Ex-
have.
Scary.
So
Yeah.
the thing is, the lack of understanding will cause the mind now to function, over function, and the mind will start imagining that this is like a direct hit on their existence. So what we call, like our program, your program is no fear. So I was just checking on various definitions of the fear. So what is fear? So
Yeah.
one definition was that forget everything and run.
Yeah.
So, but that cannot be in this case. So
Yes.
you cannot run away.
It's
Other
not the
one
key
was that fight everything and rise.
and
That's
rise. Yeah.
very good to say, that fight everything and rise. But that fighting, this the person who has asked this question is asking the same thing. That zone of fighting everything and rising itself is not so easy. So you
Yeah.
have to go through a lot of psychological stresses as well as socio-economical stresses. And
Exactly.
then the one definition which was appealing a bit more to me was false evidence as appearing real. There's something mind is now imagining, like you have something which your doctor told you that it is very easy to cure, easy to treat, or it is early stage cancer and we can cure you, we can treat you, and you may have to take treatment for this much duration. But our mind is not really listening. At the portion of
Exactly.
listening, we are listening, but the acceptance in the intellect is not going. So
Exactly.
our mind start extrapolating a disaster which is coming up.
Exactly. So, if I may, I thank you for talking about Fear No More, the program of Fear No More. And to answer to the question, is Fear No More, and each letter has a definition. Fear is face your fear. The E is explore your resilience. A is for taking action, and R is for rise. Okay, so as you said, doctor, when a patient receives the diagnosis of being having the cancer, cancer itself a word that it's very scary. So whenever someone receives this information from the doctor, he can't, like you said, he can't keep following and listening. The mind shut down, and the person, his mind, start to make his own stories, imagination, and think for the worst case scenario, and completely I am done, and I'm gone after, I don't know, even tomorrow, so which is not the case. As you said, that the cancer become now very, I will say, more than before. I mean, like before it was very scary. Right now it's very, I mean, it's curable. It's something that you can cure. It's whatever the stage you are, there is always a solution. So first, when we take this one, so I can take now, if I want, we have, the grief cycle, whenever all the five stages that the patient go through, and you can tell me your patient, most of the patient that you've seen from which stage are going. Basically, we have from the shock and the denial. The first time there is a shock, why it's happening to me, no, it's not possible, no, I'm healthy, I'm eating healthy, we don't have any case of cancer in our family, etc., and why it's happening to me. Then after, there is the anger against the person who gave you the diagnosis, against yourself, because you think you are not taking care of yourself, or about against the others because they are pushing you, about the society. As you said, we are all, the lifestyle is not helpful for us right now. Okay, that's when we start to accept and to understand. So this anger, then we have the bargaining. So here, oh, if I did this, or if we can remove this the sickness or this disease, I will have a lifestyle, very healthy lifestyle, I will eat healthy, I will not eat junk food, I will not do all these kind of things. Then when we realize that, yeah, it's here, there is nothing we can do, nothing we can change, there is the deep side of the curve, which is the depression. The person goes under depression, through the depression. They don't accept it, to just shout down, they don't accept the treatment, they don't accept to go to see a doctor, they don't accept the help of the family, the support of anyone around them, etc. Then when the person is over all this, here comes the place for for the acceptance, and for the acceptance and taking actions. Okay, so all these are the five stage that people, emotional stage that people are going through, but they don't, in each person it's different, it's going, so someone can go from the stage 4 to stage 3, then it's different level, not necessary on this logical chronological pattern. Okay, but it's changing. And how we help, for us, we call them the clients as a coaches. How we help them on the way, how to first to face them, to uh, demystify a little bit what is this cancer, to understand what are the options we have in front of us, what does it mean, from what are we scared, why are we scared from that, what can we do about it, how can we change, and we start to talk a little bit with our mind, and our mind, we start to reframe our thoughts, because our mind can be our best friend or our worst enemy. Most of
Yeah.
the time, it's very easy for us to think, the worst case scenario, it's coming automatically because the mind imagine and is going through and doesn't let us think about the positive side, what can be done. We've seen and we can see around us how many people went through the cancer, okay, and they are here, they are still here, and they are living a life better than other people. They are more healthy, they are enjoying their life, they understood what helped them. Very easy, if you sit and you discuss with them, it's just reframing, just focusing, just breathing, doing all these mindfulness techniques, all the yoga that you said, all the spirituality level, also, and reframing, very reframing, practicing gratitude, walking, doing sport, having a healthy lifestyle, eating properly, and choosing very wisely what to eat is also very helpful. Okay, so we have another syndicate one who said, "Thank you, doctor, for all your encouragement during my treatment at ACOC in Dubai. She had a radiation with you, wonderful team in November and December 2019." Okay,
Okay.
in this night, thank you, doctor, for all your valuable, interesting information. Thank you, okay, for your support. So, doctor, so let's go back to the emotional side of this cancer, the impact of this cancer on the patient. Can you talk to us about that? As you have seen for these 24 years, many patients, when you tell them that they have the cancer, what is their first
So as
reaction?
you said that, I will go back to what you said. I completely agree with you.
Yeah,
You are a life coach and academically absolutely correct what you said. And this is what we see in every day-to-day scenario, and we understand it is human to pass through these stages.
exactly.
I would rather, today I was sitting and I was thinking how to present it. So you have put them into five different phases. I have clubbed them into one word, which I call it as, like, I put a, if you can read it. So it is like resistance. So stress.
Resistance.
So if we see the first
Yes,
formula, it is mathematical equation that stress which a patient will go through, or we will go through, or the family will go through. We should not ignore even the family.
the
So that
family.
is
Yes,
the pain is the diagnosis which has come.
yes,
So
yes,
that, with resistance is our non-acceptance. Our mind
yes.
will not be able to accept that now this disease has come, which will have long, difficult treatments, which can debilitate us, which can be a threat to our existence. So all these factors will come to the mind. So mind will have resistance. The stages which you told are, I'm clubbing it all in resistance.
In resistance. Yes.
Yeah. So how to deal with it? One person has asked that how to go through this during the treatment. So what I put some formula here. So mind, uh, resistance comes in the mind. What is mind? Mind is our awareness with our thoughts. So if
Mhm.
we just allow the patient to go through these phases, so definitely it will reach a phase of acceptance. But I personally term it as a negative acceptance, because I've seen patients who are coming to me since last 5 years, 6 years, maybe more. They have accepted, they have gone through the treatments, they are now fine. No traces of cancer, and recurrence chances have gone diminished to almost zero, but still they feel stressed
They
when they come
feel.
to me
Yeah.
once a year or once in 6 months to meet me. They are so stressed and nervous. So
Yeah.
it's not because they don't like me or not like meeting me. They tell me that we are afraid and we have palpitation, not because of you. We love you, but the issue is that we feel that still something can be detected. So that acceptance was actually a negative form of acceptance. So why this negative form is coming? So if we understand mind, we will understand that it is because of the thoughts. We are not able to control or change our thought patterns. So thought
Oh,
patterns develop from childhood till the late ages. So it is not related to cancer. Any trauma, you lose your job, you meet an accident or some disaster, or something happens in other part of the world, Your thoughts can make you negative anytime. There is a war which you may not like, which makes you uncomfortable. So all this will make you uncomfortable. So these thought patterns have to be changed. And here where, you know, different type of yoga techniques, different type of yoga has a full scientific technology to deal with this. Somewhere
Yeah,
we have to understand that we have to link our children or our own self at any age to yoga. So it is
to
nothing to do with any religion. All religions are welcome, and it is a part of yoga. So I group it, into four stages for my patients. Like if I have to work future, I want to work with different hospitals to group these sufferings, how to relieve the patients from these sufferings in
things.
four different ways. So
Yeah,
first is that the patients should be involved in some sort of selfless service that purifies our mind. What type of selfless service can a patient do, or a family of the patient do? Like when a patient is diagnosed with cancer, they have a family of 5, 6 people. So the support is only of 5, 6 people who are equally nervous. So
mm,
create a group of patients who have gone through the similar thing to expand this family, so that when a patient is newly diagnosed with cancer, we introduce them to patients who have already been through this journey. And I can tell you with my experience, patients, the impact on the psychology of the patient is more from other patients rather than doctors and nurses. We do impact them, but you can hear me? Yeah, the
yes,
support which they get from other patients is tremendous. Then
exactly. Yeah.
this is the selfless service we need from the patients. They have survived and passed through this journey. All these patients who are messaging you, I would be very delighted if they can join and form a group to help the
Oh,
patients who are newly recruited.
yes. Thank you. Thank you, doctor. Very, very good point. I will mark it because we have to talk about this group, the supporting group, and what you mentioned also about the thought. What you said about the thought that is coming with us from since we were young, from the trauma, etc., which we call in positive intelligence something that we are working also, which we have our saboteurs in our mind, the one that we had developed with us since we were young. The role is to prevent us from imminent danger, either emotional or physical, and are developed with us since we were young, and to protect us or to make us integrate community, and we continue to carry them with us. But as we have some question, I will give the priority to some question. Which one? It's really I put this question also to ask you because it's something that I've been asked a lot. And it say a lady, Mima Awa, she said, is there a scenario that delayed symptoms can show up after 2 or more years of treatment? So this is one question. If I can add another question, and maybe you can combine them. If someone had already cancer and cured from the cancer, is there any chance, or maybe there is, because people are worried that the cancer will develop in another part of the body?
So
So
this
this is
is, I think, both the questions are related to post-treatment of the initial cancer, and
yes.
this is regarding the stress we face when we are on the follow-up. The cancer patients we see quite often. Yeah. So the first thing is that you are cured. So first of all, you should be getting that confidence there that the main disease has gone. The
Yeah.
most chances of cancer coming back depends first of all on the site, on the biology of the tumor, which your doctor will explain and which we can explain you in the first visit itself. But the most chances are within the first 2 years. The recurrence chances. That's why our follow-ups are more intense in the first 2 years. And
First
then, yeah, then after the first 2 years till the 5 years, that is the next 3 years, we relax a bit in our follow-ups. And then after 5 years, it is almost negligible. So we keep lighter follow-ups, like once in a year, not much of investigations needed, just follow-ups depending on the symptoms. So this is the way it proceeds. But that doesn't mean that we should take it as a stress, because these follow-ups are based on recurrences seen as per the stage, as per the biology of the tumor, on a basis of population. So
Yeah.
population may have 20% recurrence chances or 25-30% recurrence chances. That doesn't mean that definitely that patient will recur. So it depends on how good your initial management has gone, how your tumor responded. Still, you see, although so much of advancements, our science is not individualized. So we do, maybe in near future we will have every cancer as per and treatments as per the individual. So we, our treatments and our understanding is still majorly based on population based statistics. It is changing, but it will take time to be completely individualized medicine.
Yeah.
So you don't need to be stressed that it will happen to you. So you have to live in the moment, as we say. So that is
Exactly.
what yoga teaches you, to be in the moment and enjoy. Like, we do not know tomorrow somebody is driving and meets an accident. And I have seen my patients who have metastatic diseases spread all over the body, and they cured, means cured, recurred, again cured, and they are living their lives since years.
Exactly.
So
Exactly.
you have to trust the medical fraternity, the treatment options, and the advancements will go on. And you have to trust, I think you have to trust whatever divinity you believe in, whatever God you believe in. Finally, you
Exactly.
came into existence not by your will, and we all will go out of this body not by our will. So we can't keep stressing ourselves for that. So this is where, the divinity part, the love, the what we call love to God comes into picture. And
The
I feel that is the faith in God is itself a science. It may not be, we cannot reproduce that science in our labs, because our science labs are not meant for it to reproduce that. We can do objective studies, but the faith and God is more of a subjective analysis.
Exactly. And if I may add, the doctor, to this question, exactly, we have to live in the present moment. We had or you had the cancer, and it's gone, or you are doing the treatment and it's going, it's improving. Okay, so just enjoy this moment. Just stay in this moment and believe that everything is gonna be okay. The mind can really, if you think, in the neuroscience, in the I mean, suggest that if your mind can make you sick, the mind can cure you, can help you to cure. Okay, so this is the way how you can help your doctor to help you and to go through the treatment. So you have to believe in your doctor, you have to have a good relationship with your doctor. There is a trust relationship with your doctor, and you follow. And your mind don't let your mind to be your enemy, let it be your friend, your
Yeah.
ally. Okay, it will help you, because if you think that, like the law of attraction, if you can bring it here, if you believe that you can cure, you can cure. Okay, it's something that you cannot control, no one can control. As you said, doctor, we have a faith in God, or wherever, whoever are you believing in, you have to trust, and you have also to believe in your body, that your body can cure itself. So try to do it, doing mindfulness, doing the yoga, doing the breathing, being present, doing the positive intelligence, which is being present in this moment, and focusing and quieting your mind that is feeding you with very bad thoughts or very negative thoughts. And the negative thoughts, what they do, the negative thought, the thought, the idea is coming, the thought is coming, then you feel it in your body, and your body think, that this is what it should be, and it start to secrete, so you feel it, and your body start to secrete the cells and the proteins that they are sick, because this is the alert, that the message that your brain is getting to, okay, so I'm not going well, so everything is going bad, and it's producing cell and sick cells, like, if I can make it in very easy way. Okay, so just believe in that, practice the gratitude, practice the yoga, breathe, enjoy the life, and let the things take place. Okay, so just don't live in this thought or fear of of getting back this cancer. If you are like, if you are living in that, you will for sure bring it back. Okay, so it's not something that we control, so let it go and enjoy this moment. So I just wanted to make it short, that's why. Okay, is there a scenario? Okay, Cindy, she said absolutely, the mind is pivotal. I focus on getting through each treatment and planning the next step. The mind can assist us to overcome the discomfort of the body. Thank you, Cindy, for sharing that. Smita Kapoor is saying, thank you, Dr. Abhinav and Yasmina. This session is certainly very informative and useful. Thank you. And Musarat Latif also, thank you, Doctor, for your valuable information. Piyush Rihan, thank you, Dr. Abhinav. My friend Kadir, 2 years going treatment and is doing very well now. Thanks for sharing, Piyush, and we hope that your friend will stay, inshallah, in health, in good health. Nadia, thank you, doctor, and thank you, Yasmina, for the valuable information and advice. Hind, thank you for okay. Monday talk. Thank you for. I mean, what an amazing synchronization, Yasmin and Dr. Abhinav. Thank you very much. Saba Ali, Dr. Abhinav, thank you. Excellent insight and guidance on the topic. And Saba Ali, okay, we have. I'm just looking for if there is any other question. Can you tell us how you got through it all, Yasmina? Yeah, thank you, Monday talk. Yes, I also went through this, and it was a decision. So I was already coach, and when I received that I had the cancer, so I'll just go in few minutes. I It was scary. I went through the 5 steps also, one shorter than the other, but I didn't stay. I chose to move on and to accept it and to trust God, or to believe that God will help me to go through it and it will be easy. And alhamdulillah, it went easy. So anyone want to talk about that, please get in touch with me. You have my contact, and we can put maybe also the contact of Dr. Abhinav here, and we can create. I want to go back to the invitation of Dr. Abhinav to create a supportive group for person going through this cancer, or the supporting family, because we know perfectly that the family also is going through everything the patient is going through, or the sick person is going through. Okay, so we are here to create the supportive group and to help with that. Our dream with Dr. Abhinav is to bring this to the hospitals and to bring this supportive. The medical side, of course, it's covered by the doctors, and we have Dr. Abhinav, who is a very good doctor and who is dealing with that. And we want to bring this emotional part, which is very, very important. And I remember even when I was young with my late father, when he was sick, we was always saying that 90% of getting better is the mind, is the mindset. Okay, so
If you allow
yes.
me, just add to this and to your talk about this, that I want to convey to everybody that be it cancer or be it any other trauma or sufferings, there exists in yoga definite technology to deal with mind. Like it may appear that these are all theoretical talks in but it becomes very difficult to control mind. Yes, definitely it will become impossible to control mind and to control thoughts. It is not easy just to say that be positive and start thinking positive. It will not happen like this. It is a
Exactly.
technology, it is an thing which is going inside, and it is a machine. Mind is a subtle machine, and we have to learn how to deal with that machine in our favor. and it turn it around to help us, you know. And this technique is called yoga. So there are various techniques which have to be taught, which have to be learned, and we together can learn it, we together can move with it. So apart from the, the suffering of the body, which we are dealing with our various modalities, we I also want to create a group which can help our patients and our society to deal and to learn how to deal with the mind.
Yes,
That
yes,
is
yes,
feasible, and it is
exactly.
not theoretical, it is practical, and it is achievable.
Yeah, so please reach out to us and let's create this supportive group, and let's make it possible. And believe, I mean, remember that you are not alone. There is a lot of people going through that, and just sharing the experience, talking about it will help a lot. Okay, so anyone, so anything you would like to add, doctor? The mic is.
I think we'll end up with a positive note that definitely there is a way forward, even for the psychosocial trauma. We are doing very well from biomedical care, and UAE is also advancing a lot in this. We have now many oncology centers, and all are perfectly, they can be compared to any good centers across the world. But we have to grow in the psychosocial area. We have to learn and teach our patients and even general society how to deal with the mind. The mind is another thing which can cause an impact, positive
Exactly.
impact also. Yeah.
Exactly. Thank you. Thank you very much, Doctor,
Thank
for
you.
being here with us. Thank you for sharing your expertise, for sharing your insight. Thank you for bringing your support to this emotional support that we want to bring to the community and to help people with that, as we believe that a big portion of uh, curing from any trauma, like what you said, it's the mindset. The mindset is very important, and we are not just saying that we have to be positive and forget about everything. No, it's the way how we shift our mind, and the way how to deal with the situation, how to accept that something can that it's happening, but we can go through it, we can face it. We've been through a lot of trauma, a lot of difficult situation, so we have the power inside us, you have the power inside you, and everything can be I mean, seen and reframed, and we can do whatever you can control. Forget about what it's not controllable. Okay, what is not controllable, even if you do whatever you want to do, it won't change. What will change is the way how you talk to yourself, the way how you deal with the situation, and the way how you accept the situation. So just I would like also to say, please reach out to us if you have any story you would like to share in Fear No More. And remember that you are not alone. We are here for you. Thank you very much, Dr. Abhinav, one more time for this time. And for sure, we will have another session where we
Yeah.
will talk more about this emotional and psychological effect. Thank you, everyone, for joining us from everywhere, from UAE, from Canada, from US. Thank you very much. And from Jordan also. Thanks a lot. And see you next session. I mean, see you in our next session of Fear No More Live. Thank you very much, everyone.
Thank you.
Thank you.